You sit down to breakfast, maybe it's 7 in the morning, maybe 8. You're having what you've had for years, what millions of Americans have every single morning. Toast and coffee, or cereal and orange juice, or a bagel with cream cheese, completely normal. The kind of breakfast you see in every restaurant, every hotel, every home in America. But within 30 minutes of finishing that meal, something dangerous is happening inside your body. Your blood pressure is spiking. We're not talking about a few points, we're talking about jumps of 20, 30, sometimes 40 points in systolic pressure. Your heart is suddenly working much harder. Your blood vessels are constricting. And if you're over 65, if you already have high blood pressure or heart disease, this morning spike could be the trigger for a stroke or heart attack. I'm Dr. Arya, and I've spent 25 years in geriatric medicine watching patients do everything right with their medications, their exercise, their stress management, and still have uncontrolled blood pressure. And when we dig into their routine, we find it, the breakfast, the same meal every morning that's sabotaging everything else they're doing. Today I'm going to tell you exactly which breakfast is causing this, why it's especially dangerous for seniors, and what you should be eating instead. Let me tell you about Edward. He was 72 on 3 different blood pressure medications, doing everything his cardiologist told him to do. But his morning blood pressure readings were consistently 165/95, sometimes higher. His afternoon readings were much better, around 138/82. His doctor kept increasing his medications, but those morning numbers wouldn't budge. Edward was frustrated and frightened. He didn't want to add a 4th medication, but it seemed inevitable. I asked him to keep a detailed food diary for 1 week, writing down everything he ate and when he checked his blood pressure. The pattern was immediately obvious. Every single morning, Edward had the same breakfast: 2 pieces of whole wheat toast with butter, a glass of orange juice, and 2 cups of coffee. Then he'd check his blood pressure 30 minutes later, 165/95, like clockwork. We changed his breakfast entirely. Eliminated the juice, reduced the coffee to 1 cup, replaced the toast with eggs and vegetables. Within 1 week, his morning readings dropped to 142/86. Within 3 weeks, 138/84. We didn't change his medications. We changed his breakfast. That's how powerful this is. Here's what you need to understand about what happens to your blood pressure in the morning and why breakfast matters so much. When you wake up, your blood pressure is already rising. This is the morning surge I've talked about before. It's driven by cortisol and adrenaline, your body's wake-up hormones. Your pressure is climbing naturally as part of your circadian rhythm. Now, if you're over 65, that surge is already exaggerated because your arteries are stiffer and your baroreceptors are slower. Your body doesn't regulate the increase as smoothly as it did when you were younger. So you wake up with pressure that's already elevated compared to your nighttime baseline, and then you eat breakfast, and depending on what that breakfast is, you either stabilize that pressure or you send it through the roof. The wrong breakfast hits your system like throwing gasoline on a fire. It compounds the natural morning surge with additional physiological stress. And your cardiovascular system, especially if you're older, can't handle both at once. So what is the worst breakfast for blood pressure? Let me be very specific because I want there to be no confusion. The absolute worst combination is refined carbohydrates plus sugar plus caffeine plus salt. And that describes the standard American breakfast perfectly. Toast, bagels, cereal, pancakes, waffles, pastries. These are all refined carbohydrates. They're stripped of fiber. They digest rapidly. Orange juice, sweetened yogurt, flavored oatmeal, fruit smoothies with added sugar. These are concentrated sugar. Coffee, and especially multiple cups of coffee, that's caffeine. And then there's the hidden salt. It's in the bread, the butter, the cream cheese, the bacon, the sausage, the breakfast sandwiches, the hash browns. Every single component of a traditional breakfast is working against your blood pressure. And when you combine them all in one meal, first thing in the morning when your pressure is already surging, you're creating a perfect storm. Let's break down exactly what each component does to your blood pressure, because understanding the mechanism makes this real. Start with refined carbohydrates. When you eat white bread, white bagels, most commercial cereals, your body breaks them down into sugar almost immediately. Your blood glucose spikes within 15 to 20 minutes. When blood sugar spikes, your pancreas releases insulin to bring it back down. But insulin doesn't just lower blood sugar, it also causes your kidneys to retain sodium. More sodium means more fluid retention. More fluid retention means increased blood volume. And increased blood volume means higher blood pressure. This happens every single time you eat refined carbs, but it's especially pronounced in the morning when your system is already in a state of physiological arousal. Now add actual sugar on top of that. Orange juice is one of the worst offenders. People think they're being healthy. It's fruit, it's natural, it has vitamin C. But an 8-ounce glass of orange juice contains 21 grams of sugar and almost no fiber. That's the equivalent of eating 4 oranges worth of sugar without any of the fiber that would slow down absorption. Your blood sugar doesn't just rise, it skyrockets. And that massive insulin response causes immediate sodium retention and blood pressure elevation. Studies have shown that drinking orange juice causes blood pressure to rise by an average of 8 to 12 points within 30 minutes in older adults. 8 to 12 points from one glass of juice. And most people are drinking it every single morning, wondering why their blood pressure won't come down. Then there's caffeine. Now, I need to be nuanced here because the research on caffeine and blood pressure is complex. For people who drink coffee regularly, the blood pressure effect is usually modest, maybe 3 to 5 points, because you develop some tolerance. But here's what matters. That effect is most pronounced in the morning. When you drink coffee first thing in the morning, on top of the natural cortisol and adrenaline surge your body is already producing, caffeine adds additional stimulation. It constricts blood vessels. It increases heart rate. It triggers the release of more stress hormones. And in people over 65, especially those not habituated to caffeine or those drinking multiple cups, the blood pressure spike can be significant. I've measured increases of 15 to 20 points within an hour of coffee consumption in some patients. Add that to the sugar spike from juice and the sodium retention from refined carbs, and you can see how the numbers add up. And then there's salt. Most people don't realize how much sodium is in a typical breakfast. 2 slices of bread, 300 milligrams of sodium, 2 tablespoons of butter, 150 milligrams, an ounce of cheese, 200 milligrams, 2 strips of bacon, 400 milligrams, a breakfast sandwich from a fast food restaurant, easily 800 to 1200 milligrams. The American Heart Association recommends no more than 1500 milligrams of sodium per day for people with high blood pressure. Many people are getting half that or more in breakfast alone. And remember, when you consume sodium in the morning, your body retains fluid throughout the day. That retention is cumulative. By evening, you're carrying extra fluid volume, your blood pressure is elevated, and you can't figure out why your medication isn't working. It's working. Your breakfast is just overwhelming it. Let me give you the science because I want you to understand this isn't my opinion. A study published in the American Journal of Clinical Nutrition followed older adults and measured their blood pressure response to different breakfast types. They found that breakfasts high in refined carbohydrates and sugar caused an average systolic blood pressure increase of 18 points within 1 hour. Breakfast high in protein and healthy fats caused an average increase of only 4 points. That's a 14-point difference based solely on breakfast composition. Another study in the Journal of Hypertension found that eliminating morning fruit juice in people over 60 with high blood pressure resulted in an average reduction of 9 points in systolic pressure within 2 weeks. No medication change, just eliminating the juice. Now let's talk about why this is especially dangerous for seniors. First, you're starting with higher baseline pressure. The natural aging process, arterial stiffening, all of that means your resting blood pressure is already higher than it was when you were 40. So when you add a breakfast-induced spike on top of that, you're reaching dangerous territory. Systolic pressures of 180, 190, even 200 are not uncommon in the hour after breakfast in older adults eating the wrong foods. Second, your blood vessels are less resilient. They can't expand to accommodate that pressure surge. In a younger person, the vessels flex. In an older person with stiff arteries, that pressure slams against rigid vessel walls. That's when plaques rupture. That's when clots form. That's when strokes happen. Third, many seniors are on medications that interact with these dietary factors. Diuretics are trying to remove sodium, but you're putting it right back in at breakfast. Blood pressure medications are working to lower your pressure, but the breakfast spike is fighting against them. Here's what a typical dangerous breakfast looks like, and I want you to see if this describes yours. You wake up, you have a bowl of cereal with milk and sliced banana. Seems healthy, right? But most cereals are refined carbohydrates with added sugar. That's strike 1. You have a glass of orange juice. Strike 2. You have 2 cups of coffee with cream and sugar. Strike 3. Maybe you add a piece of toast with butter and jam. Strike 4. Within 30 minutes, your blood sugar has spiked, your insulin has surged, your sodium retention has increased, your blood vessels have constricted from the caffeine, and your blood pressure has climbed 25 or 30 points. You check your pressure and see 172 over 94. You take your morning medication and wonder why it's not working. It is working, but your breakfast just overwhelmed it. Or maybe your breakfast looks like this. You go to a diner or a fast food restaurant. You order a breakfast sandwich. Egg, cheese, sausage on an English muffin. Sounds reasonable. But that sandwich contains 800 to 1,000 milligrams of sodium, 40 grams of refined carbs, and a significant amount of saturated fat. You add hash browns, another 400 milligrams of sodium. You have orange juice and coffee. By By the time you finish that meal, you've consumed 1,500 milligrams of sodium, 60 grams of refined carbs, 30 grams of sugar, and 200 milligrams of caffeine. Your blood pressure doesn't just spike, it explodes. I've seen patients hit systolic readings over 190 after these kinds of breakfasts, and they have no idea why. They're just eating what everyone else eats. So what should you eat instead? Let me give you the blueprint for a blood pressure-friendly breakfast, because I'm not just here to tell you what not to eat. I want to give you a solution. The ideal breakfast for blood pressure control is high in protein, moderate in healthy fats, low in refined carbohydrates, and very low in sodium and added sugar. Here's what that looks like in practice. Eggs are your best friend. 2 or 3 eggs, cooked any way you like, scrambled, fried in a small amount of olive oil, or boiled. Eggs are pure protein and healthy fat. They don't spike blood sugar. They don't cause insulin surges. They keep you full for hours. Add vegetables, spinach, tomatoes, peppers, mushrooms, onions. These add fiber, nutrients, and volume without carbs or sodium. If you want some carbohydrate, choose a small portion of steel-cut oatmeal with no added sugar. Not instant oatmeal, which is refined. Steel-cut oats have intact fiber that slows digestion and prevents blood sugar spikes. Or have a slice of true whole grain bread, the kind with visible seeds and grains, not the soft wheat bread that's basically white bread dyed brown. Add half an avocado for healthy fat and potassium. Potassium helps counteract sodium and lower blood pressure. Include some berries, blueberries, or strawberries, not juice. Whole berries have fiber that moderates the sugar absorption, and limit coffee to 1 cup, preferably after you've eaten some food, not on an empty stomach. If you need a second cup, make it decaf or have tea, which has less caffeine. Here's what this breakfast does differently. The protein and fat slow down digestion. Your blood sugar rises gradually, not in a spike. Insulin response is moderate. Sodium retention is minimal if you're not adding salt. There's no juice to cause a sugar tsunami. The caffeine is moderated by food and limited in quantity. Your blood pressure might rise slightly as part of the normal morning pattern, but instead of jumping 25 points, it rises 5 or 8 points. That's manageable. That's safe. And over time, keeping your morning blood pressure in a safe range reduces your overall cardiovascular risk dramatically. Let me tell you what happened with another patient, Margaret. She was 68, and every morning she had what she called a healthy breakfast. A big bowl of granola with low-fat milk, a banana, and a large glass of cranberry juice. She thought she was doing everything right. Granola is healthy, right? Fruit is good for you. Juice is natural. But that breakfast contained 65 grams of sugar and 45 grams of refined carbohydrates. Her blood pressure was spiking to 178/96 every single morning. I showed her the math. I explained what was happening inside her body. We switched her to Greek yogurt with a small handful of nuts and berries and 1 slice of whole grain toast with almond butter. Same volume of food, completely different metabolic effect. Within 2 weeks, her morning blood pressure readings were averaging 142/84. 1 month later, 138/82. Her cardiologist was able to reduce one of her medications, all from changing breakfast. Now, I need to address something important. Some of you are thinking, but I've been eating this breakfast for 40 years. If it was so dangerous, wouldn't I know by now? Here's the thing. Your body at 70 is not your body at 30. When you were younger, your pancreas was more efficient, your insulin sensitivity was better, your blood vessels were flexible. Your kidneys processed sodium more effectively. You could handle that breakfast without major consequences. But now, your metabolism has changed. Your arterial compliance has decreased. Your hormone regulation is different. The same breakfast that was fine at 40 is dangerous at 70. Your body has changed. Your diet needs to change with it. Let me give you some specific swaps so you can make this practical and immediate. If you currently eat cereal, switch to steel-cut oatmeal with nuts and a few berries. If you currently drink orange juice, eat a whole orange instead, or skip the fruit juice entirely and have water or herbal tea. If you currently eat toast or bagels, switch to 1 slice of true whole grain bread or eliminate bread altogether and add more eggs and vegetables. If you currently have multiple cups of coffee, reduce to 1 cup and have it with food, not before. If you currently eat breakfast sandwiches or fast food, make eggs at home with vegetables. It takes 10 minutes. It's cheaper, and it won't spike your blood pressure. If you currently add salt to your breakfast, stop. Let your taste buds adjust. Within 2 weeks, you won't miss it. Here's what I want you to do starting tomorrow morning. Before you eat breakfast, check your blood pressure. Write down the number. Then eat your typical breakfast. 30 minutes later, check your blood pressure again. Write down that number. Compare them. If your pressure went up by more than 10 points, your breakfast is part of your blood pressure problem. Do this for 3 days with your current breakfast. Then change your breakfast to the high protein, low sugar, low sodium model I described. Do another 3 days, checking before and after. Compare the results. You will see the difference. This isn't theoretical. This is measurable. You will have the data right in front of you. Now, I want to address the people who eat breakfast out regularly. Diners, fast food, restaurants. Eating out makes blood pressure control much harder because you don't control the ingredients. Restaurant food is loaded with sodium. It's loaded with refined carbs. It's loaded with sugar. If you must eat out, here's what you order. Eggs, any style, with vegetables, no toast, no hash browns, no cheese. A side of plain fruit, berries if they have them, black coffee or tea, no juice, no pancakes, no breakfast sandwiches. It's not exciting, but it's safe. Most places can accommodate this if you ask clearly. Let me also talk about what happens over time when you continue eating the wrong breakfast. Every morning your blood pressure spikes. Every morning that spike damages your blood vessel lining a little bit. Over months and years, that cumulative damage leads to atherosclerosis, hardening of the arteries. It makes your blood pressure even harder to control. It increases your risk of heart attack and stroke significantly. You're not just dealing with a temporary spike. You're creating chronic vascular damage morning after morning, meal after meal, and eventually that damage manifests as a cardiac event, a stroke at breakfast time, a heart attack while reading the morning paper. And everyone says it came out of nowhere. It didn't. It was building for years. Every single breakfast. Here's your complete action plan. Starting tomorrow, implement the breakfast changes I've outlined. High protein, healthy fat, vegetables, minimal refined carbs, no juice, limited coffee. Do this for 2 weeks. Monitor your morning blood pressure every day. Write down the numbers. After 2 weeks, look at your average morning blood pressure from before the change and after. I'm confident you'll see a significant improvement. If you do, you've just identified a major modifiable risk factor. You've taken control of something that was silently damaging your cardiovascular system. If your numbers don't improve significantly, there may be other factors at play, and you need to work with your doctor to investigate further. But for most people, this change alone will make a dramatic difference. Now I want to hear from you. What do you typically eat for breakfast? Have you ever checked your blood pressure before and after breakfast? What numbers are you seeing? Write it in the comments. Share your breakfast routine. Your experience might be exactly what someone else needs to hear to make a change that could save their life. If this video just explained why your morning blood pressure has been so high despite medication, share it. Send it to anyone over 60. Send it to your spouse, your parents, your friends. This is information that should be standard teaching for every person with high blood pressure, but it's not, so I'm telling you directly. Next week, I'm going to talk about another meal timing issue that's critical for seniors. The worst time of day to take your blood pressure medication and why most people are getting it wrong. This could be the difference between controlled and uncontrolled hypertension. You're not going to want to miss that one. Subscribe to Dr. Arya Senior Health so it's waiting for you. And one final important note, everything I've shared today is based on cardiovascular and metabolic research and my 25 years of clinical experience. But this is educational information, not personal medical advice. Your specific health situation, your medications, your medical history, these all require individualized guidance from your physician. Use what you've learned here to have a better, more informed conversation with your doctor. Be proactive, be informed, take care of yourself. I'll see you next week.